slide set for that? Okay. And please, I just want to let you know that we are going to be recording this meeting, and I will share it all with you. Okay, well, we're very excited to have you all back in this meeting series. I'm not sure what it was called beforehand, but we're calling this SHRUG, the Share Registry User Group meetings. And these meetings are intended to provide updates to and receive feedback from you all. Historically, these meetings were held twice yearly, and the group can decide on what timing and meeting cadence works best for us. Let me know who's here. Drop your name and role and your hospital in the chat if you'd like to. You don't have to, but I would appreciate that so I could get to know some of you and where you are, and more specifically your role. I would appreciate knowing that. For the transition, I've scheduled 2 meetings. You'll have noticed you were invited to one on today and the other one occurring on August 22nd. And I want to be very clear that this is the same meeting. I wanted to do 2 separate meetings in the launch month of REDCap so that everybody had the ability to at least come to one of them and have some questions to get familiarity, and then the opportunity to come to 2 of them if any questions still persist. But the meeting on the 22nd will be, the information presented will be the same in this meeting as well as that one. So if you don't feel like coming to both of them, you definitely don't have to, but I welcome you to come to both. So for the share team, these meetings for us represent the culmination of a lot of hard work. And I'd like to take a moment to introduce the ADHS share team. Oh, thank you. I see you guys are putting your names in the chat. I appreciate that. Thank you. Okay, so you've heard me sign, you see me sign emails, the share team, and communications, the share team. Well, this is your share team. First, we have Dr. Gail Bradley, who's serving as the Bureau's medical director and has been providing oversight and review of various aspects of the share transition. Next is Vatsal Chakani, our business intelligence analyst and biostatistician. Vatsal is responsible for EMS data dashboards and help modernize the share program by implementing new data architecture, if you're familiar with Snowflake, for our shared data, as well as applying a machine learning algorithm for case matching. These are significant improvements that allow for faster and more reliable case matching and report building. Next is our epidemiologist, Josie Johnson. Josie built the form that many of you are already enjoying, and her role will be, she'll be responsible for ongoing technical support and making form changes and edits that the group decides that we need. We'll see that REDCap, we have a much greater level of control over REDCap than we did over the previous SEER system. Next is Ann Vosbrink, our AZ Peers data administrator. Ann is a critical team member because of her expertise with the AZ Peers data set, the EMS data set, which is the hospital that we match, which is the data that we match hospital data with. Next is Julia Venton, our office chief. She is the office chief for the services section, which is where the share program is housed here in the Bureau of EMS. Julia contributed by her leadership, editing and reviewing documents, and setting up the financial support necessary to cover the server costs for REDCap, which are significantly less, which are very cheap. Let me say that they're not terribly expensive, and we're happy about being cost effective. And then I'm Adam, and you all know me, and I work with you to maintain the program and hopefully expand the program, really. One of the major limitations of the program is that we only get the outcomes from you, from participant hospitals. And so ideally the entire state would be reporting, and then we would have the best idea. So hopefully you are all leading, you're all in a position to lead the state in terms of, look, this is our product, and this is what we're able to get back to the state. And hopefully that motivates other hospitals in the state to want to report as well. Okay, these are some of the people, to give you an idea of how many people, how large this project was. These are some of the background, some of the people that are behind the scenes, that are systems engineers, architects, administrators, analysts. All of these people helped in one aspect or another about this transition. The Tamer team is the team that we use to develop a machine algorithm. I may be using the wrong terminology, but a machine learning algorithm to match our cases. And so again, these are significant advancements, and it's all thanks to these team members. A lot of people worked on this. Okay, thank you for introducing yourselves in the chat. I appreciate that. Okay, just a few high-level updates. The SHARE registry has transitioned from CEDAR to REDCap for out-of-hospital cardiac arrest and STEMI. The address is right there, share-redcap.azdhs.gov, and we're going to get into that in just a moment. So you can type that in or click on it, and we will get you in shortly. REDCap is open for data entry on August 1st. If you haven't already gone through this process, I see a great deal of you have already logged in, and that's fantastic. But REDCap is open for data entry and has been since August 1st. We're overlapping REDCap with CEDAR by a month. So CEDAR will be taken down August 31st. And the reason for that is to give you the choice of when your program wants to make that switch for you. So we don't need everybody to line up on one big day where cases on one day stop and the next day start. You can choose amongst your team whatever transition works best for you. The only real caveat, the only ask is that you don't enter the same record into both systems. So we don't want duplicate copies, although we ought to be able to catch that. So that's up to you, although ultimately CEDAR will be taken down, decommissioned offline August 31st, 2025. So you will have to have made the full transition into case entry into REDCap by then. And then lastly, I have to thank you all for your efforts in the 2024 data catch-up effort. That is going to make the forthcoming annual report that much more robust. And we are very appreciative that you all took the time to do that. And so hopefully with this new system, there's going to be far less missing cases and that kind of type processes to tackle. So hopefully this REDCap makes it easier in a number of different ways. All right. A high-level review, an overview. I like to use this as this is meant to serve as an overarching reminder of our mission. It's the only slide I'll probably read directly, unfortunately, and it is the longest one. The SHARE objective, the objective of the SHARE program is to promote a comprehensive standardized system of post out-of-hospital cardiac arrest care throughout Arizona, encompassing the entire chain of survivals, bystanders, dispatchers, EMS providers, and hospitals. That's you, our cardiac receiving and referral centers. This is accomplished in part by systematically storing, collecting, and analyzing data processes across the chain of survival. Working together, we promote evidence-based treatment and improve survival from out-of-hospital cardiac arrest and STEMI. That is a great statement to encapsulate the idea and essence of SHARE, to help us remind us of the overall sort of mission or objective of SHARE. A bit more, we mentioned the chain of survival, a bit more to help more clearly define SHARE. A SHARE case is one that is generally interacting with the chain of survival. A SHARE case is, well, when I say the entire chain of survival, a SHARE case is generally one that interacts with the chain of survival when a patient is experiencing out-of-hospital cardiac arrest or STEMI. Because the essence of SHARE is to look at the chain of survival, that's the global look at it. But there's other patient populations that we still want included. A common population that should be included that doesn't exactly fit the chain of survival is a POV arrival to the ED for like a heart attack. We still want that information, even though they didn't interact with EMS or anything like that. They still drove to the hospital, and so there will be an option for POV, privately owned vehicle arrival to your ED. Or perhaps even in a rarer case that someone got resuscitated and then refused treatment. That is ultimately the goal. That's ultimately what we're looking to do. But so there are some caveats to this, but generally speaking, we want a case that has interacted with the entire chain of survival. Okay, zooming in a bit more, the definitions, we can use a couple of definitions to rely on whether or not we should be entering something into REDCap as a SHARE case or not. So using these two definitions, we should be able to arrive to whether or not we should be filling out a form. If you're not sure, because there's a myriad of different things that can happen and they don't all fit neatly into this, just email us, email share@azdhs.gov, or email me or Josie Johnson, and we'll get an answer for you. But the two definitions are these. An out-of-hospital cardiac arrest is defined as an out-of-hospital cardiac arrest that's not caused by a traumatic event where 911 responders attempt to resuscitate that person using CPR or defibrillator. It also includes someone who may have received an AED shock prior to EMS's arrival. Again, we're looking across the entire chain of survival. The important caveat is that we're not including traumatic arrests. There's too many unknowns, too many variables with a traumatic arrest to fully understand if our pre-hospital interventions are really any good, if there's a trauma there. So it's too uncontrolled, so we leave that population out. So it is these two definitions that we are going to ask you a yes or no question on to determine what question set you see and where these patients get divided out to. Previously, you used to have to choose yourself between these, but now we're just going to have you fill out one form that we'll see here soon. Asking you the yes and no between these two questions gives us three interesting patient categories and one that we don't care so much about. So for example, if you were to answer, yes, this was an out-of-hospital cardiac arrest, but no, it wasn't a STEMI, we would have all of our OGAs. If you reverse that and you say, yes, this was a STEMI, but it wasn't an out-of-hospital cardiac arrest, we have all of our STEMI and myocardial infarction populations. And if you answer yes to both, yes, this was an out-of-hospital cardiac arrest, as well as yes, this was a STEMI, we get out-of-hospital cardiac arrest patients that are affected by STEMI type processes, which is a unique category between the two. And then less interesting, if you answer no to both, it's more than likely that case that you're looking at probably isn't a share case. If you answer no, it wasn't out of hospital, no, it wasn't a STEMI, it's likely not a share case. But again, nothing, because of the range of possibilities that are out there, trying to fit them through my system, everything isn't black and white. So again, if you're not sure, just ask. Okay, so the logging in for the first time, I hope you all have received an email on August 1st. You should have received a series of 2 emails, one from REDCap admin, and I'm giving you an opportunity to type this in. If you guys would like to follow along after this, we're going to get started on case entry and looking at REDCap. But if you'd like to follow along and you haven't yet, this is what you should be looking for in your email. One email from REDCap admin titled REDCap Access Granted. That gets you into the system as a whole. That allows you to set up your password for your account. And then once that's done, you should have gotten a second email adding you to our project, REDCap Project Access Granted. And that will be where our data is entered. Okay, I'm going to pause for a moment and I'm going to stop sharing, and I'm just going to see if anybody has any questions so far before we move on. Okay, great. All right, follow along. I encourage you to log into REDCap Live yourself if you'd like. If that's not available or convenient for you, follow along in the share quick start guide that I supplied. I think this is very I think that's very accurate. It should follow. Or the data entry manual, all have the same outline, the same steps that we're going to take to enter a couple of share cases. Okay, so when you go to share.az or share-azdhs, I'm sorry, share-redcap.azdhs.gov, you'll see your login screen. Hopefully you've set that up and you just want to log in. And this will take you to your homepage. And this is where the project lives. You may see, actually, this took me one past, my apologies. It should take you to this one. You should be, this is the screen you'll see when you log in. It jumped right to the last screen I was at, so I wasn't expecting that, my apologies. This is the first screen you see. This is the home screen. Ignoring everything else on the screen, we're gonna go straight to My Projects, and you should see the share case, the share project there. It should be the only one you see there. There's 2 here because I'm going to mess with one that isn't live, so I'm going to use this test share. But to get into our project, you're going to click on share. Okay, so this is your share homepage. This is where all of your navigation is done from. This is where communication is done from, and this is where your records live. So ignoring everything on the page, I'm just going to go to add edit records, and we're just going to try a couple of records. A couple of notes: if you abstract for more than one hospital, across the top and next to the tab called data collection, you'll see for which hospital you're entering data. And so for those of you that enter data for multiple sites, before you add a record, we want you to switch to the correct hospital. So whichever hospital this record is going to go into, make sure you click switch and select, oh, you can't see my drop down, but I think that's pretty clear. Switch to the hospital that you're going to be entering for. So make sure it says what you'd like it to say for which hospital in these two spots before you enter a record. Okay, let's go ahead and add and edit a record in red here on the left. Okay, ignoring everything else on the page, we're just going to click on the green add new record. And I'm going to put in I'm going to drop a case in the chat, and I'm just going to work through it. So if you can see the chat, I know not everybody can probably access the chat, but I'm going to drop it in the chat so you can follow, and then I'm going to read it out loud. So EMS brings in a patient with CPR in progress. Efforts were terminated 30 minutes after arrival to the ED. Your staff suspects a history of poorly managed CHF as the major factor contributing to this patient's out-of-hospital cardiac arrest. Okay, I know I'm leaving a lot out there, but I think that's enough to answer what we need to answer. Okay, so there's two forms that each case needs to have filled out. The first form is what we call the inclusion criteria form. It's how we determine what patients go into what buckets, and we also verify which hospital that you're entering this information for. So we have you again, is this the correct hospital? Sure. If it's not, go ahead and contact me or share at AZDHS or Josie. Okay, here's the two questions. Was this case an out-of-hospital cardiac arrest, and was this case a confirmed STEMI? You do have to answer both of them, but you can answer in any combination that's appropriate to your patient. Like I said before, if you answer no to both of these, you're going to get a message that says this isn't a valid share case, or at least the system doesn't think it is. So, again, ask us if you think something might be incorrect. But for this case, let's see, EMS brings in a patient in CPR in progress. So that sounds like an out-of-hospital cardiac arrest. And they suspect a poorly managed history of CHF. I didn't see anything in the record about STEMI, so we're going to click no for STEMI. We're going to choose a method of completeness. And this is just for your own reference. This doesn't have anything to do with submitting, editing, or locking the charts. This is just for you to reference how complete the record might be. So you can mark it as incomplete if all of the data fields aren't filled out. You can mark it as unverified if you're not sure about a data field, but we're going to go ahead and mark it as complete and save it, exit the form. That will generate the next survey to be filled out. So once we make it past that inclusion criteria, once we sort of qualify and place your patient in the correct bucket, and that form is saved, you then see this share case data form. To begin that, click in the circle here. I hope you can all see. Click on the circle, and this is really what you're expecting to see. Okay, let me just work to it top to bottom. I'm going to do 3 cases, just back to back to back, real quick entry, and then I'm going to show you navigation around the system and some different system features. So if I seem to be ignoring things, I apologize, and I'll make sure to get back to it later. And if I don't, please feel free to ask me questions. But filling out a couple cases really quick. Responding EMS agency, as you expected, this is a dynamic menu, so we can type in the name of any particular agency, and it should auto-populate, so you don't have to scroll through 300 something agencies. The option is also available for POV. You can type that in if someone drove themselves to the ED. Okay, first name, type in first name, type in last name. Mr. Share, that is a male. Date of birth, okay. This is REDCap is a lot easier than CEDAR. Everything is month, day, year, and the fields for entering date of birth, we can say 3/1/1922 and hit tab, and it'll take that. We can say 3-1-1922, it'll take that. You can click on the calendar and you can utilize that method, or you can just click today and then modify the dates in there. All of the date time fields work the same, and so pretty flexible use of those. I find that to be pretty convenient. The medical record number, if you have it, medical record number. This is a free text field. I can't type and text a free text. Okay. This is it can be alphanumeric. It can be any combination of letters and numbers that represent your MRN. Great. Date, time to arrive. So let's say they arrived today, but just a little bit. They arrived earlier today. We'll put them at 8:30 this morning. Okay. And what happened to this patient? The efforts were terminated 30 minutes after arrival to the ED. Okay, that sounds like they died in the ED. Okay, date and time of discharge or death 30 minutes after. Let's see, I'm gonna click, change that to 08. And if they died a half an hour after, they're like 8:54, something like that. Okay. Okay, was the final diagnosis acute myocardial infarction? No, the blood work didn't show anything. There was we had no reason to suspect this. I don't think so. And so if it wasn't a STEMI and it wasn't a myocardial infarction, then we're going to ask you sort of what was it then? And I hope the majority of you are familiar with this. And from what I've seen from your submissions, and the reason why I chose this particular pathway was to explain this list and mainly explain the cardiac option, just to be clear. So this cardiac option is reserved for, actually, this is a great time for me to demonstrate the data entry guide. So I shared with you the data entry guide, which looks like this, and maybe you're not sure about an answer. So you're going to reference the data entry guide and go to the table of contents, and this is clickable. You can click through. So I want to know about the data fields. And what question do I have? I was wondering about suspected cause of cardiac arrest. So I'm going to scroll down until I find suspected cause of cardiac arrest. And I'm going to see what the parameters are for entering this. Okay. So suspected cause of cardiac arrest is here. I would like to choose cardiac, but I need to make sure that it's what I think it is what I think it is. So choosing cardiac, I'm saying that I'm explaining a CHF or valvular disease, an aortic disease, or any other type of cardiac process that isn't exactly an infarcting process or an ischemic process. So using the data entry guide, you would go, okay, great, that sounds about right. The CHF is a good explanation. So cardiac, great. Okay, you can make whatever comments you'd like. This is unlimited. A lot of you have been just dropping narratives in here. That's fine. That's great. I don't mind that at all. You don't have to put narratives in there, but our system administrators might scream at me, but if every case comes in with narrative, to me, that might be better, but for them managing the data, it might be worse. I don't know. But if you feel like you need to drop details in there, just do so. Okay, we choose a method of, or a level of completeness. I think I answered everything in here pretty thoroughly. There's nothing left blank, and save and exit the form. This is a submitted share case. There is no submission. I know our brains kind of want to click a button and submit something and it's gone. But submitting simply means you have these two green circles here. Those two green circles tell us that this form is ready for uptake. We're going to uptake is a different conversation. We're going to uptake on a cyclical quarterly period. So I'll get more into that. I can explain more of that later, but we're not going to take the record immediately. We're waiting some time, 90 days, 120 days after these records are submitted to make sure that everything you want is in there and the edits are made and that they are indeed ready to go. So this is what we're looking for. There is no submitted status in REDCap. I know that sounds interesting, but we determined that this type of functionality may be better overall, but maybe you all can let me know different. Okay, so that was for a gentleman who arrived in the ED with CPR in progress, who had CHF, who expired in the ED. Let's do one more. Well, I have 3 planned. Let's see if we can get to all 3. I hope I'm not being too wordy. And then again, pause me at any time if we have any questions. Okay. I put a new scenario there in the chat. I'm in my share project homepage. I'm going to go to the add edit records on the left side, the red add edit records, and hit the green add new record. Okay. This is the correct hospital. I'm certain I want to be entering it for Josie Hospital test REC. Okay, the case I dropped in the chat says EMS achieves ROSC in the field and arrives with a conscious patient to your ED with a chief complaint of chest pain. STEMI doesn't show on any monitor. The patient is admitted to a floor, and eventually blood work shows cardiac biomarkers showing tissue damage, cardiac tissue damage. The patient codes on the floor and expires in the hospital. I hope these cases make sense. If they don't, they're really just to demonstrate the system. So I apologize if they're not right. Okay, so this wasn't out of hospital cardiac arrest, but the patient was brought to us conscious. So that's great. But this patient did suffer, yes, an out of hospital cardiac arrest. Was this case a confirmed STEMI? No, the monitors didn't show STEMI. We didn't pick up, so we didn't see STEMI. And again, STEMI, the reason why we're asking for STEMI is because we needed something to connect it to EMS. Because EMS makes their yes or no heart attack decision based on the presence of a STEMI, we had to ask something similar. And the reason why I'm saying that is because we're going to ask perhaps a confusing question here in a moment. So yes, this person was not hospital cardiac arrest, but they did get defibrillated and ROSC was achieved. But no, we didn't find a STEMI. However, their chief complaint is chest pain. Okay, this could be a share case. I'm going to save and exit the form. And once again, we have another case to fill, another survey to fill out. This is called the shared case data survey. Click on the circle and we'll do the same thing again. This was flown in by Error Methods. Great. This was Mrs. Share. Okay. Date of birth, we can do 2 digits for the year. So you can do 4/1/45 and hit tab, and that will take the birthday. MRN is a free text field, and I'm just going to say they arrived a few hours ago. Okay. What else? Let's see. So now we're down to the outcomes portion, and these questions will change. You'll see things pop up and disappear as you answer the question. So they arrived with a conscious patient. They were admitted to the floor, so that means they did not die in the ED. They made it to the hospital, so they're admitted to the hospital. And now we see a new question pop up because now they made it to the hospital and there's additional questions to ask beyond that of the ED. This patient codes on the floor and expires in the hospital, so died in the hospital, and the date, time of discharge or death. So we're going to say now, and it was a really quick turnaround and they got admitted, but they expired in 2 hours. So we're just going to mark their time as now. We are going to ask, was the final diagnosis acute myocardial infarction? And I chose this pathway for a specific reason. STEMI, when we ask you about a STEMI, that's how we're going to conjoin EMS's ability to correctly diagnose STEMI, EMS's ability to correctly diagnose STEMI. And then we also want to know who died of infarctive processes that weren't STEMIs. And I hope that makes sense. So if we're asking acute myocardial infarction, I want to know, was infarctive cardiac cell tissue damage occurring? Was it diagnosed in any other way? Was it diagnosed by angiography? Was it diagnosed by biomarkers, by blood work, whatever have you? That can be yes. So we wanted to make sure we were very careful to say who's a STEMI, and then also who has chest pain, infarctive, AMI, acute myocardial infarctive type processes occurring. So I hope that makes a little bit of sense. So no, he didn't show a STEMI on the monitor, but yes, we did find some biomarkers that indicated that he was having an acute myocardial infarction. I don't know if that's possible in real life. I'm just making sure that you all know. I think it is. Isn't it true that a STEMI is a subset of acute myocardial infarction? I believe that to be true. Okay, because they made it into the hospital, we're going to ask you hospital procedures. And if these look somewhat familiar, these are the same questions coming from CARES. So was targeted temperature management continued or initiated in the hospital? No, he was conscious. So we're going to say no, he was awake and following commands. That's why we didn't do TTM. And then, I don't know, you guys have to help me with the exact, do you do an angiography for this? I'm not sure. Do you do, let's place a stent? I don't know. Yes or no to all of these. Unknown if you're a referral facility, perhaps they went to, you don't have the backside of their record. It's perfectly acceptable to answer unknown. Moreover, we're going to see that you submit that quite often, and we're going to know that you're a referral center. And so answering unknown isn't exactly detrimental to us. So if you don't know, you don't know. That's fine. Okay. We're going to make comments, drop the narratives, whatever have you. choose a method of completeness. How much of the form do you have complete? And again, this is for your reference. We'll do unverified, and I'm going to save and exit the form. And all that's going to do is make that dot yellow to tell you you're not sure about something on that form and that somebody in your team needs to go back and enter that, which is as simple as clicking back into it and making that change. Okay, I made that change. Let's say, oh, a cabbage was performed. All right. Okay, that's the part I wasn't sure about. I'm going to go to complete, save and exit the form. And that is share case data right there. That's green. Okay, I think I'm running a little fast. I don't know if I have time for the third case. So I'm going to move on to navigation features and maybe some errors that you might see if nobody has any questions about case entry. Okay. Okay, great. We are at our share homepage. Okay, so the way you're going to navigate your project is on the left-hand side. You'll see these tabs over here. There is, oh, sorry, let me back out even more than that. Let's go all the way back to the homepage. Let me back up to the homepage. Okay, when you first log into the homepage, you'll see a bar across the top that has a few buttons in it: My Project, Help and FAQ, Training Videos. These are all valid for us to use. My Projects is where your projects live. That one should be somewhat familiar. But what I wanted to highlight was some of the other features in here. Help and FAQ, specifically data entry and collection. That's what you are all most concerned with. These are a lot of the common questions that we might get about REDCap and perhaps how I enter and view my data. So this is the REDCap help user manual that comes along when you use a system like REDCap. So if you go to Help and FAQ data entry collection, a lot of your questions are going to be in there. How do I delete? Can I edit? Can I delete all of my records? So there's quite a bit of usefulness in here. Furthermore, across the top, you'll see training videos. These are absolutely valid for us. Data entry overview is the one you're going to want to pay attention to. It's suitable for training data entry staff. It's a 19-minute long video that covers all of the buttons on our form, on the share case data form and the inclusion criteria form, how to save, how to exit, what every little feature about our data entry form. You can also email us in here if you'd like to. You can email us directly in the application if you'd like to. Just use it as a standard email inbox. And then we also have a messenger system that if you'd like to communicate with your other abstractors or perhaps me or however, whatever method you'd like of communication, all of these are valid. I haven't received any. I don't think I have any yet. I hope nobody's tried and I don't see them. But I'd be interested to see if this works. Create a new conversation and you can choose anybody in our user group and message them. Okay, sorry, let me go back into navigating our project. All right. Okay, navigating our project, everything that has to do with your records and how you manage that information is within your project. Yours will just be called share up here, but this is called test share. Okay, so this top section was the communications section. Okay, moving down, the project home and design, this is project home. If you click project home, you're already there. This is your project home page. Okay, next to it is what's called the code book. What this is all of the questions that you could possibly see and all of the logic needed to see them. And so if you're curious about everything that you could be asked, you can visit the code book, and it's going to give you the logic behind why you would see suspected cause of initial cardiac arrest. You would only see this field if you answered yes to the OCA, no to STEMI, and no to acute MI. So kind of putting that in plain language, if you said, yeah, this person had an out-of-hospital cardiac arrest, but there's nothing on the monitor and there was nothing in the blood work, no STEMI, we're then going to ask you what was the cause of that arrest, and then here's that pick list. Okay, that is the code book and project home. All right, probably more useful to you is the data collection tab. Okay, there's two buttons under the data collection tab, your record status dashboard. This is going to tell you all of your records and their statuses, and this is where you can click into them and edit them and change them and do whatever you'd like. So if ShareBear was maybe not the right case to enter, or we had something wrong, we can go here, we can delete this. Maybe I don't like naming it ShareBear. So you have control of your own records. Previously, you all had to email me and ask, can you unlock this for me? And I'd have to go, sure. But now you can, there's no locking. And so you can edit the records as you'd like. And if you mistakenly entered a record overall, just delete it in that record's homepage by choosing an action for that record. Okay, that is the record status dashboard. Again, if you click record status dashboard, this brings you to see your overall look for all of the records in your data access group, or more specifically at your, how do I want to phrase this? I think this is all the records in the group of your hospital data abstractors, not for the entire project of share. So if you share abstraction duties with other people for your hospital system, you'll see your hospital system in here. Okay. You'll notice it also has an add new record button. So that means that both add edit records and record status dashboard are locations to add a new record. Great. Okay. Adding and editing records is what we went through before to do it, but I'm going to show you in a bit of additional functionality. This is how you can search your records for something. Perhaps if you're oh, that's right, we named a bunch of people John Doe or whatever. You can search for it here, and you can get everybody with that name in your records and then bring them up in that search. And so if you, well, that's super useful. I think you all know. I think you're all identify the usefulness of that. So, oh, you can't see the pop-up here, actually. Darn it. I don't know how to share my screen so you can see the pop-up. Darn it. Okay. Well, actually, you can see what I do select. Okay, so I have selected, I'm going to search by first name. I'm going to type in their first name. You can select any of the fields in the form to search for. So if you're looking, for example, perhaps a date, time of arrival set of cases, you can choose that and then search for that. Okay, the last section is called applications. That's this tab down here on the left. This is a navigation bar. And then applications. I don't know how much use you'll all have for the calendar, but what I did want to point out was this second bar, which is data exports, reports, and stats. That's going to be everything that your hospital group has entered and any way you want to cross-tabulate that. But for simplicity, we're just going to look at all data and view the report. And it's just going to bring up every case we have, and it's going to bring up each of them. So you can look at it as a large grid. There's lots of ways to filter this. There's lots of search. There's lots of ways to, again, cross-cut this so that you can audit your own information. You can also build your own reports by making custom selections or creating new reports. There's a number of things you can do to this that I would encourage you to visit the REDCap website for additional help trying to generate these reports. Okay, that covers 2 share cases. Let me look at the last thing I'll show you is a couple of errors and what you might see if you put in argumentative information. Okay, I'm going to open an old record and I'm going to change a couple things and show you some of the errors that you might get and show you some of the additional navigating in here. Okay, tab moves you forward through things. Tab is, if you try to hit enter, for example, if I try to hit enter, it's going to save the form. And so if I have something missing, like if I unclick something, perhaps if I say, reset that. If I unclick something, let's unclick these 2 and then hit enter, I'm going to get a warning that you tried to save, but there's a couple of fields empty. So this is one of a couple of different warnings that you're going to get if you save a chart or a record here that may be missing information. So you have your choice here. Okay, I'll stay and play or leave and ignore the record. Okay. So that's one of the errors you might get. Another error you might get is if you go back and change information. The branching logic is pretty linear. It takes you straight forward, so you shouldn't get a lot of errors. The only time you get errors is when you go back and change information so it becomes argumentative. And what I mean by that is if we change this now to died in the ED, there's no way they can have died in the ED and also have died in the hospital. Okay, so if we click died in the ED, we're going to get, oh, darn it, you can't see that error either. Let me find a solution to this. Let me find a solution. I'd like you to see these errors very specifically. So I think if I do my entire screen, which is a little iffy, but I think. Okay, you should be able to see the error. That's my whole screen. Okay, so for example, if I change this to discharged alive or swapped it to a contradicting logic, you're going to see that there's a problem here. The field that you just entered requires different information. If you want to erase it and go back to that original information, hit OK. If you want to stay where you are, hit cancel. So I want to erase it and go back. And it'll do that for everything it sees to go backwards. That's not that it'll create. It'll make it be non-argumentative. It'll erase the values that are in there. So clicking through OK brought me back to where it was no longer argumentative. I hope that makes sense. I know that's a bunch. Okay. The last few bits of navigation are you can click reset down here in this lower right of any of our fields, and it just simply takes that information away. This H button is the history of that particular data field. So each data field has a timestamp in it that is recordable and measurable. So if you want to know who put what in, you can do that. Okay. Let's see. I think, at the very bottom, you can delete data for this form only. So if you're not sure or you've messed something up, you can click this button. You'll get a quick warning. And yeah, I do want to delete everything for this form, and it takes us back to square one. Essentially, we haven't started this. Okay. So that's some of the functionality. That's some of the navigation. I hope the demonstrations made sense. I hope that the definitions of share share cases made sense. Okay, that's right where I wanted to be. I want to stop right there and ask you all for your questions. Let's have a look at the agenda. Let's see. Okay, so we accessed REDCap, we entered case, we talked about other features. Yeah. Okay, I would like to see if anybody has any questions. I haven't been able to see the chat. I don't know if you all have been asking questions in the chat, but okay, I don't think I missed anything. All right. Q&A. I left 10 minutes for Q&A for our group. Does anybody have any questions?
So this is Rhonda. I'm fairly new to the position, never done this before. So when I've been entering the previous ones, what I'm seeing now is that there's no like address and all of that information that they're asking for, address and phone number and all of that we were putting in the old system. Is that correct? More simplified.
Yeah, the only address information we're collecting is for survivors.
Okay.
So if you're admitted to hospital, and then if you're discharged alive, that now pulls up survivor fields.
Okay.
That was my third case, and I didn't want to, I was afraid of running out of time, Rhonda. My third case was to illustrate a survivor. So you only get, we're only going to collect the patient's address type information if they survive.
Okay. Okay. All right. Sounds
good
great.
question. Thank you. That was exactly what I needed someone to ask, Rhonda. Thank you. And while I'm at it, there you see two other fields that we didn't see. If you made it through the ED, meaning you were admitted to the hospital and you were discharged alive, now we see additional questions that have to do with that line of thinking, with that logic. We see, we're going to ask you, discharged from hospital, where did you go? And these are all CARES questions. Home, rehab, skilled nursing. And if you did have a code arrest, we're going to ask you about a CPC score on top of that. Thanks, Rhonda. That was super useful. I see a lot of you have already been using, there's already a lot of cases in there. Does anybody have any comment about its functionality? Is there any feedback on that? Is it easy? Is it difficult for some reason? Was the login process difficult? I'll take it. I'll take silence, honestly, you guys. Okay.
I haven't had to put anything in yet, so.
Okay. I am more than willing to, if you are all perhaps too shy to speak up, I'm more than willing to do a one-on-one with you. We have a great deal of faith in the simplicity of our system, and so it's not a chore for us to sit down with you all on a one-on-one and see what the system looks like for your team.
Hey, Adam, I have a quick question.
Sure. Who was talking? I think that might have been Carlos.
Yes, sir. Quick question for you. if we need to add some of our colleagues or additional staff, um, do we need to submit that information through you, or
Yep.
is there like a super admin assigned to one of our facilities that we can just do that internally?
Great question, Carlos. Because we want to be very careful with PHI, we need to verify who we're putting in the system. So that's going to be us. You're going to ask us, request us to add to your team, and then we'll do that for you.
Okay, sounds good. So the people that had access to the previous registry will have access to this current registry.
Yes, I'm certain that everybody who was on Cedar is now in REDCap.
Okay, thank you.
Thanks, Carlos. Good question. So useful. Everybody gets good use. Debbie, I thought I saw you come off mute before Carlos asked something.
Yeah, I just had a comment to make. I've entered 1 STEMI and 3 out of hospital cardiac arrest, and the system is very easy. I found the instructions were easy to navigate. So thank you. It's an easy system to navigate.
Oh, I very much appreciate that, Debbie. Thank you so much. I was hoping somebody might remark upon that. Okay, Mary Grace, that is a good question. I need to get back to you with that. That's correct. If I'm asking for date time of angiography, is that balloon inflation time or cath lab time? I don't know. I think it's
yeah, it's for the STEMI. For CEDAR, it would ask for the balloon inflation time, but I did already started on it. Now it made me confused. What time will I be putting in? Will it be the balloon inflation, or would it be the time the patient arrived in cath lab, or would it be the start of the angiogram time, or what is it?
Great question. That I believe let me get back to you on this, but I believe I've seen verbiage that says at the time of initial groin puncture.
Oh, I didn't see that though.
It wasn't. I'm only recalling that from something I've seen. I think because we've tried to align our program so closely with Share, I think I'm with CARES at the national level. I think I might be pulling that from CARES. Let me double check. That's a great question.
No worries, no worries. But the system is very easy to navigate. I like it.
Thank you. That was the goal. Actually, that brings me that I have housekeeping to do. I need to share your missing list with you. And the motivation for holding the missing list until today, which I'll share with you, was so that you had an opportunity to go back and instead have to drag you through Cedar to enter a bunch of backlog cases. You can now just do them in REDCap if you wish. And to be clear,
that okay.
Is that okay? Sorry, did I cut you off, Mary?
Oh, it's okay. I thought the missing list were already done because you gave me that deadline.
We did, yeah. So we're going to start sending missing lists every quarter. That missing list was to make sure that the 2024 annual report data set was as complete as possible. So that was really asked for the entire calendar year of data. Okay. Now moving forward, each quarter, we're going to show you a much smaller, hopefully, missing list.
Oh, great.
Moving forward, yeah. And our Ann Vosbrink came up with a very clever solution for you all to be added to, I might mess up the verbiage, but basically image trend accounts so that you could see the EMS transports coming to you.
Gotcha. Okay.
Yeah, I think that's a method. I will look in more to that, but she said she was very confident that we could get this Shrug user group set up in Hospital Viewer, I think it's called, or Elite Viewer, something Viewer. I'm sure you guys know better than I do. To actually query AZ peers for the cases that come to your hospital, which would be fantastic.
Okay.
Awesome. Any other questions? Oh, okay. Julianne is saying in the past we entered OCA and STEMI separately. With the REDCap, does it enter them each into the yes? So let me show you how we do that by just asking you one. So okay, I'm not sharing my screen. Hang on, Jules. Okay, so instead of having you choose which form to fill out, we're going to ask you the inclusion criteria. That is the That's this form. And the inclusion criteria form basically does this for us. It sort of sorts it for us. And so instead of having two independent forms that go from top to bottom, we just ask you, what combination of answers do you have for these two questions? Was this an out-of-hospital cardiac arrest, and was this a STEMI? So, Jules, if you have a cardiac arrest that had nothing to do with STEMI, simply answer it yes, OCA, and no STEMI, or any combination of those answers. And so that's how we're not having you choose between two forms. I hope that makes sense. Okay. Yeah. So yeah, we with these two questions, with was this an OCA and was this a STEMI, effectively we create this Venn diagram. We know who has died of an out-of-hospital cardiac. Oops. We know who's died of an out-of-hospital cardiac or suffered an out-of-hospital cardiac arrest because of electrocution, drowning, respiratory, whatever. And then we, in the middle there, oh gosh, in the middle we know who died of infarctive processes, ischemic heart attack processes, and then we know who had only heart attacks that had nothing to do with out-of-hospital cardiac arrests. So by answering those two questions, we get this Venn diagram. And then over here, not a share case, is if you answered both of those questions no. So for example, if we go back to the inclusion criteria form and I say no to both, you're going to get this message here that says this isn't a valid share case. Probably. This is just what the catch-all from the computer. So if you think otherwise, feel free to reach out and ask us about what's going on. But this, I know, this is probably, I think that I got the most questions on was, how do we choose which one's which, and you don't. And so I hope that lends to its simplicity. Okay. What other questions, y'all? Excellent. Okay, so let me leave off with, I'm going to follow up with your missing lists. You are more than welcome to put any information to REDCap for cases starting January 1. You can go all the way back to the day one of this calendar year, utilizing REDCap for any of your backlog cases or however you want to do it. Hopefully you don't have that. I know it kind of pays off for people who were a little bit not lazy, but wait a little bit long time versus people who are really on top of it. Again, just feel free to message me, whatever have you. I'm going to follow up with a survey. I'd like to ask you all how this went, and then we will post minutes. We'll follow up with minutes for this meeting. Please don't hesitate to reach out to me. We're going to have the same meeting again on the 22nd. Please come to that one if you would wish, but it's the same meeting. We have a few minutes. I'll turn it back to you, and I'll hang out for anybody who'd like to sidebar afterwards or what have you. Okay, that's all I have for you guys. I really appreciate your time today. I really look forward to getting you in the new system. Let me know if you have any questions.
Thank you, Adam.
Thank you.